lovely people. I welcome you all back to another health session with Asosika. Kindly subscribe if you're new to this channel. Share it to a friend and a loved one because in today's episode, I'll be discussing about hypertension. Relax, grab yourself a cup of coffee or tea, and let's educate ourselves on hypertension. The point I'll be elaborating on in my video would include your blood pressure, normal blood pressure range, what is considered to be normal, risk factors related to high blood pressure, how to measure your blood pressure at home if you're unable to visit any nearest medical center, management, lifestyle modifications, and importance of your medication. Okay, so as I said earlier, relax and let's get ourselves educated.
During blood circulation, a force is exerted against your artery wall. So this is the artery wall, and arteries carry blood from our heart to other parts of our body. So they act as a tube through which the blood flows through. So when your heart beats, it pumps blood to your body through a network of vessels or blood vessels, and these vessels are known as the arteries. Okay, so the strength of the blood pushing against the wall is what is known as blood pressure. So in simple terms, we can say that blood pressure is the pressure of blood pushing against the walls of your arteries. So as you can see in the video, yes.
When you visit a hospital or you try to monitor your blood pressure at home using the digital monitor, two numbers would be appearing on your screen. The upper number is what we call the systolic pressure, and the lower number is the diastolic pressure. Systolic pressure is the pressure exerted on our blood vessels when the heart contracts. So when the heart contracts, the pressure in which the blood is flowing through these vessels is what we call systolic pressure. Diastolic pressure is the pressure exerted on the walls or on the blood vessels when the heart relaxes. So the heart beats with a particular rhythm, and in between these beats, it rests. So to rest, the pressure in which the blood is flowing through our vessels is what we call as the diastolic pressure. Okay, yes. The normal range of blood pressure is 120/80. Basically, the systolic pressure should be higher than the diastolic pressure. Now, let's look at how the heart beats and how the blood flows through our vessels to meet the demands of our body. So blood pressure is very important and required because it plays a vital role in our body. When you take our body, for instance, like our system, our whole system, the blood acts as a transporter. So in the body, we can consider it as a delivery guy, okay, because it delivers all the nutrients, everything the organs requires, the blood is there to supply. So yes, so we know that one of the most important vital organs in our body and which cannot be replaced, or which we have no alternative way of replacing that, I guess, is the brain. So we can't replace the brain, okay? We can't replace the brain, but we can like if it is treatable, we will, but we can't replace the brain. So the brain can only survive for 5 minutes without oxygen, maximum. After 5 minutes and the brain is being deprived of oxygen. So oxygen is very important. It's being deprived of oxygen. the brain cells will start to die, and this will lead to brain damage, which we would say brain death. Because if the cell starts to die, that means there is no activity going on in the brain, so you are brain dead. So when a trauma patient comes to the hospital, the first thing the doctors consider is the heart. So they make sure that they try to do everything that is required and make the person's heart start beating. Yes. So they'll bag the person, try to perform CPR, everything that is necessary, things that is required, will do it to save the person's heart first. After saving the heart, then the second most important organ, which will be the brain, they'll check the brain activity. After the heart starts pumping blood, they'll check the activity, whether there are any electrical signals going on. Then they'll check other part of the body. So the heart is very important, and that is what determines a person's life, whether you are dead or alive. So when the person's brain is not when there is no activity going on in the brain, we consider the person to be alive because the heart is beating. And the heart, without the heart, 85 or let's say 90% of the body organs will fail. But without the brain, at least 90% or 80% of the organs in our system will be functioning without the brain's activities. So the heart is very important, and it should work in that time frame required of it. Okay, so it's very important that our heart works under the pressure required and meet the demands of our body.
Now, on what basis would we diagnose you of hypertension? Hypertension is like having your BP consistently above the normal range, and this can lead to the damage of your arteries. So if the pressure is too much, you can damage your arteries, and it would also increase your risk of getting heart attacks, strokes, heart failure, kidney and eye damage.
Okay, so risk factors related to high blood pressure: alcohol consumption. In my previous video, I discussed about the effect of alcohol on our body. If you haven't watched that, kindly do so because it's very informative and helpful for you. Smoking, overweight, high cholesterol level in your blood, high blood sugar level, and physical inactivity. So all these things can be some contributing factors in getting hypertension. So please check it out and do something about it. You monitor your blood pressure on a regular basis. So how would you do that? So first of all, if you don't want to visit any nearest, or you are unable to visit any nearest medical center to you, you can purchase the digital BP monitor, which you can do at home with the help of your family member, or you can do by yourself actually. Yes. So before you measure your blood pressure, make sure that you are sitting comfortably in a chair, preferably a dining chair, with your back laying straight and supported. Make sure your feet are flat on the floor and your legs aren't crossed. Avoid smoking avoid smoking when you want to take your blood pressure, because as I said, it is a risk factor. Okay, so you should avoid that. You want to take it. If you want to know the real numbers or the real readings, you should avoid smoking. Also, rest for maximum 5 minutes before you take the readings. Okay, so rest for 5 minutes, quiet rest, and you take the measurement on your left arm. Okay, on your left arm, and make sure you don't take the measurement over the clothes. So don't take the measurement with your clothes. So you try to push your clothes a little bit upper and you take the measurement. Okay, yes. And also take maximum 2 readings with 1 minute interval in each of them. And yes, monitoring your blood pressure is very important, and you should do that regularly. In the morning, before you take your medication, you should check your blood pressure. Evening, before you take your supper, you should also check your blood pressure. And so what are some of the lifestyle modifications you can, change? Yes, the first one is your eating habits. Try as possible as you can to eat a well-balanced diet. So a well-balanced diet should include fruits, vegetables, low-fat dairy products, nuts, legumes. Yes, basically those things will help you along with your medication. Also, avoid salt intake. If you're a hypertensive patient, probably your doctor would have told you to avoid salt intake. Why is he saying that? When you take in sodium, so sodium is a mineral required in our body to help maintain or balance our fluid levels. Okay, so sodium also helps our nerves and muscle functions. And the function of sodium is it retains water in our body. And when water is being retained, that means our fluid levels also increase, which will increase our uh, blood quantity. And when your blood quantity is increased, that means blood pressure will definitely increase. Okay, so there will be too much of blood in your system. Okay, yes. Also, someone will also be asked, or you might also be asking, wondering, so what is the required amount of sodium I should take in a day? A normal adult or a normal person without any hypertensive complications or without being diagnosed of hypertension, maximum you should take 2,300 milligrams of salt per day. But a hypertensive patient should only take not less than 1,500 mg per day. Yes, so that is the required limit of salt or sodium you should take as a hypertensive patient. Also, as an hypertensive patient, you should try to eat foods that are rich in potassium. So taking food that are rich in potassium like avocado, apricot, honeydew melon, grapes, potatoes, greens, spinach. Yes, so all these foods are rich in potassium and you should make sure you include these in your foods. But if you are having any kidney diseases or if you're being diagnosed with any kidney disease, you should avoid taking in potassium, please. Please avoid that if you have any kidney related diseases. Avoid taking in potassium. But if you do not, then taking in potassium is a very good habit. Next one is limiting alcohol consumption. Yes, I said earlier that I have made a video about the effect of alcohol on our body. So if you haven't watched that, please go into my description box. The link is there. Watch it and know the amount of alcohol required a day. So yes, I won't go much into detail regarding alcohol. The next one is to stay active. Be physically active. You can't just wake up in the morning without doing any activity. You just eat, sleep, just a one-way routine. Try to involve in some activities, try to do some exercises to keep your circulation, to increase your blood circulation. Okay, so try to be active, and this is very important. So yes, take that into consideration. Your stress levels. So recently my recent video was about stress management, and maybe most of you might have watched that. If you haven't watched that also, the link is in the description box. Please watch it and you will get enlightened about whatever thing you're supposed to do and how you would be able to manage your stress. So managing your stress also is very important. It's one of the lifestyle modifications you should take into consideration. Wait, try to do some exercises. So it goes hand in hand with the physical activity. So if you become physically active, then you will maintain your normal weight. So overweight is not good, and overweight leads to certain health complications as well. So try to manage your weight by engaging in physical activities, manage your stress, avoid alcohol consumption, eat a balanced diet, and with all these, with your medication, yes, medication is very important, you'll be able to control your blood pressure. So let's come back to my favorite part of our discussion today, which is medication. Most patients would ask you, I have been taking my BP medications and then now I'm feeling okay. It has lowered to the normal range and I want to stop. Please take note. You shouldn't stop taking your high blood pressure medications, even if your BP gets to the normal range. You know, taking your BP medications is very important and it continues to a lifetime. You can't stop. You can only stop taking your medication if your doctor approves of that. Listen, if your doctor approves of that, then only can you stop taking your medication. But if not, you can't stop taking your medication on your own will. Please take that to consideration. Some people also think lifestyle modification only can cure you or can control your blood pressure, and which is a wrong perception. Both of them work together. Modifying your lifestyle and taking your medication as required and prescribed. As required and prescribed. Both of these things will help you control your blood pressure. If you don't take your medications and you try to depend on your lifestyle modifications, I promise you, you can't control your BP. But if you do them together, there will be a positive result. Okay, so try not to avoid taking your medication as prescribed by your doctor or your pharmacist. You just try to take your medications on time also. Yes, try to take your medications on time. Avoid missing a dose. Yes, so avoid missing your doses and then try to make excuses. Please try to take your medications. It's very important. Please don't miss that. And most of the medications that we give to you have their own unique way of controlling your BP. Some reduces your fluid level, which will reduce the amount of blood in your body. Some also works in accordance with the minerals and the ions in your body to balance some equations there. I can't give you the details of it, but what I can tell you is to take your medication as prescribed. Avoid stopping your medication without the consent of your doctor. There are some side effects you should take notes when taking a hypertensive drug, so you can talk to your doctor if you're having any of these side effects. Feeling thirsty, skin rashes, erectile dysfunction, trouble sleeping, weakness. So all these are some side effects that you may experience when taking a hypertensive medication. So talk to your doctor regarding these side effects and he might be of a big help to you. Most patients find it difficult to remember when to take their medications, and that is one of the most one of the problems we face during patient counseling. So here are some few tips that would help you remember the time when to take your medication, so it will help you and guide you when to take your medication. So the first tip is taking your medication at the same time each day. For example, if you took your medication yesterday at 7 a.m., that means today you should take it at 7 a.m. That is the same time each day for the period of time, for the duration which being assigned to you for that particular medication, maybe 5 days. So for that 5 days, you should take your medication. Maybe you took it at 7 a.m. yesterday, so you should take it 7 a.m. till the last day of you taking your medication. So the same time each day is one of the tips that I have to offer. The second one is getting a weekly pill box. So as you can see in the picture, so a weekly pill box is a box divided into sections where you can keep all the medications you're supposed to take each day with label. So Monday you've kept all the drugs, you've divided all the medications you're supposed to take, the drugs, the medicines in that box, and you've labeled it with the days. So Monday, Tuesday, Wednesday. So that will also help you in taking your medications. Yes. Also, ask your family members or friends to remind you to take your medication. That is the third tip. The next one is getting yourself a medicine calendar. Okay, so we have something called a medicine calendar. You can get a calendar and take the dates on maybe the day you're supposed to take the medication. And I guess that one will also help you remember when to take your medication as well. You can also take your medication along with an event such as brushing your teeth. Okay, so we brush our teeth every day, and morning and evening, so it would be a reminder to you. So whenever you go to the washroom to brush your teeth, then you remember to take your medicine. Setting an alarm on your smartphone or whatever phone you're using can also help in reminding you to take your medication. Yes. So these are the few tips that I wanted to share with you regarding how you can remember to take your medications. A gentle reminder: medicine and lifestyle modification can help control your blood pressure, and hypertension is a silent killer. So if it is left untreated, it can lead to other complications. Please take these informations that I have given to you into consideration, and along with that, I hope you are able to manage your blood pressure. Thank you. My viewers and loved ones out there, if you have any health related topics you would love me to explain or make a video on, please post it in the comment section and I will gladly do that for you. This is Time with Asasika. If you are new and if you just joined, this is Time with Asasika. Kindly subscribe and share. See you. Have a nice day. Bye bye.